Today, we are talking about Janet for CCBHCs. We are so excited about this. Alita is here joining us today to talk about this with us. It's pretty exciting stuff. I'm Ginger Bandine. If I don't already know you, I'm a social worker here in Portland, Oregon, and I started Mission Driven Data in 2019. We specialize in helping agencies get better information out of their electronic health records and other data systems so that they can use that data to help make the world a better place. And Alita, do you want to say a little bit about who you are?
Yeah, sure. Thanks. As Ginger said, I'm Alita. I am currently living in Philadelphia and in Portland for the last week. Been enjoying myself here. I am one of the solutions consultants at Mission Driven Data, but in the last few months, I've really been focusing on CCBHC data and impact. Prior to this, I was doing EHR administration, quality and compliance, also have some background in healthcare and child welfare social work, and I was doing data analytics outside of healthcare and behavioral health for a few years as well.
Cool. Thanks, Alita. So just a reminder about what is Mission Driven Data. We are a company that specializes in this data stuff. We have a tool called Janet that helps you get your data out of your electronic health record. We have a free online community that you are all very welcome to join, where we share ideas, suggestions, best practices. We try to highlight guest speakers. We have co-working twice a month. We have all kinds of cool things in there. A lot of the recordings of previous sessions are in there, so I recommend checking that out. There's a link in the chat. And then we have consulting to help you expand your capacity. So these are these beautiful tulips the team got at the Tulip Festival that are full bloom right now. You can probably kind of actually see them back here in my window, but you're in the right place today if you are a CCBHC leader or a program manager and you're looking to do more with the data you're collecting, or maybe you're a data analyst and you're trying to navigate the very big package of information about CCBHC data requirements, but you also feel this urge to do more than just follow the rules, but do more, then you're in the right place. Maybe you also want to use data to tell the story of your agency's impact in your community. I think in these times that we are living in, sometimes it's nice to have data that really shows the difference you're making and to help make that case to different advocacy opportunities you might have. So that is something we're also going to talk about today. And you also want to think about how data can support your mission. So we call ourselves mission-driven data because we really believe your mission should be in charge and the data should support that mission. And so a lot of the data we're going to be talking about today is like with that in mind. We want to move things in that direction and alongside you. So we always like to start off with a quick poll. So today's poll, we wanted to ask you to think about the impact of your CCBHC journey. And if you aren't on that path yet, but you're thinking about it, maybe think about how you would imagine the impact would be of the CCBHC journey for you. So we kind of broke this out into three parts. There's the impact of your CCBHC journey on who you serve, who are the folks you serve. There's the impact on the services you provide. And then there's the impact on the results of those services. So we would just love to know, like, which of these things, and I know it's a long list of things you might be trying to have an impact on as a CCBHC, but this is a little sneak preview of this poll, which we're also going to be bringing with us to the National Council Conference in Philadelphia in a month, where we're going to have, hopefully, if you're coming there, you'll stop by our booth because we're going to have a way to live vote on these things, just to really, we really want to find out from everybody in the field, what are you thinking about when you're, becoming a CCBHC is a big project, right? Like you're going to be busy doing a lot of different things. And we know that to be taking on a project like that, you probably are thinking about, like, what is this going to do for us? Like, how is this going to help our agency? How is this going to help support our community? So we would just love to know, like, when you're imagining that, what do you picture? What do you think in some cases, it's like an influx of funding. In some cases, it's like kind of structuring things differently so that care is more integrated. Sometimes it's adding a lot of like mobile crisis kinds of services. So we'd just love to know, like, if you sit and think about what impact do you kind of imagine your CCBHC would have? Like what different categories here does that fall into? I'll say for me, because I started off, I'm here in Oregon, and Oregon was one of the original demonstration states. And we're going to talk about this later, but I was actually involved back in the day when we were going to Capitol Hill to Washington, D.C. to like advocate for the original CCBHC program. And I remember sitting at a restaurant in DC and I had my notebook out. If you've ever seen me alone at a restaurant, I almost always have a notebook out. And so I was jotting down like why, preparing for these meetings with our senators and representatives and writing out why I believed this was a good investment of funds. And I really thought about that, community mental health. I've done community mental health. I've been an intensive case manager. And when I used to do that work and go visit my clients in their homes and make sure they had groceries and make sure they weren't eating rotten food and make sure they, had a friend they could talk to if they were having a hard time, and, making sure their dog had medicine if they were sick, and all the different things that happen in like a community setting where you're really thinking about a person as kind of like your neighbor, in addition to someone who needs help with their mental health or substance use problems. I really thought about that, like all this great work is happening all around the country, but we don't have a great way of showing the benefits of that work. And my goal, my hope for the impact of the CCBHC model was that we would sort of streamline some of the ways we thought about the benefits of community mental health services. And by streamlining how those are delivered and how we measure them, we would be able to have this sort of national body of knowledge about places where this was working really well, places where people were struggling, what was the ideal kind of mix of services to offer, and what the benefits are of this huge amount of effort that's being done in all of our communities to support the people who need these services. So that was really my inspiration. That was the impact I hope to see from the CCBHC program. And if you've ever come to a webinar with me, you probably know that I don't feel like we have fully realized the potential of that, And so some of what we're going to be talking about today is our hope to add to that. So anyway, that was a long way of saying what I hope the impact is, but my hope was that it would show the value of those like really community-based services, and that with that, it would help advance how we do those services and make sure they still exist into the future. Alita, I'm curious, while people are voting, because it is a lot of questions, is there anything you think of as what you imagine the impact of the CCBHCs to be?
Yeah, I think the expanding access to people who have never had services before was really important to me, knocking down those barriers. There has to be a barrier somewhere. And I think unearthing that through social drivers of health is something that I've been passionate about looking into. And I think in addition to that is once somebody starts services, I'd be inclined to look into what keeps them engaged and reducing dropout rates and preventing some turnover at agencies as well, because I think those go hand in hand.
Cool. Yeah. Yeah. I love that, because when I was a case manager, the folks who had been there forever had a lot of knowledge and experience, and also had built really strong relationships with folks who we've all worked, most of the folks who are here today have probably worked in some kind of community setting. And so you've probably had, that one case manager who can always help the one person who, they've known forever, and they're only willing to talk to that one person. And, if that person leaves the agency, then that individual doesn't have that connection anymore. So anyway, I agree, Alita, those are really good points. Okay, guys, thanks everybody for voting. Just to give you all a sense of what you all are thinking. A lot of people mentioned expanding access to more people who have never accessed services before as one of their ideas about the future, or hopes for the future. Definitely also increasing the overall number of people served, increasing care coordination, number of services overall, serving more folks with a dual diagnosis. Peer support is another big one in here. Increased engagement, lower dropout rates, no-shows, and higher rates of completion. Increased quality of life is the kind of result people definitely voted highly on. Decreasing higher levels of care. And then lots of other people, like lots of answers to these things. So this is really cool. Thanks everybody for answering the poll. I think you're going to be excited about some of the things we're going to be sharing, because we're going to talk about how to track some of these things. So, all right. So as I already kind of mentioned, I I was involved with the CCBHC advocacy back in the day. Oregon was a demonstration state. And back then I still worked at a community mental health agency. So I helped with figuring out how to actually put all this stuff into practice. And then in 2019, I started working on Janet. And that's when I first started Mission Driven Data. I had gone to a conference about the credible EHR and realized a lot of people were really struggling just to get their data out. And so Janet was a tool I built with a partner to make it easy to get data out of Credible and then be able to do something with that data. So since 2020, Mission Driven Data and Janet have been supporting data projects all over the country, growing our team, growing our community, continuing to kind of gather best practices. In 2024, we launched Whole Person Outcomes, which was our first foray into collecting data directly from clients about their well-being and incorporating that into the data from our electronic health records. And then today, 2025, we're launching Janet for CCBHCs, which is a way to streamline all this reporting and also look at your impact. So when I think about data needs, I just wanted to mention, if you may have seen this before, we've talked about it before, but sometimes I kind of hearken back to my social worker education where we learned about Maslow's hierarchy of needs. And I think about agencies also having kind of a Maslow's hierarchy of needs, like as an agency, you also need like funding to survive, to meet your basic functionality as an agency. You need to be safe from an audit or a scary thing like that. You want to feel good about your sense of where you are in your community and with your community partners. You want to feel good about yourselves. And, you want to like, a self-actualized agency would be one that gets a gold star, like they're the Betty Ford Clinic of agencies, right? But one of the things that I learned after school was that the whole Maslow's hierarchy of needs was originally based on Maslow's experiences with the Blackfoot Nation in Canada. He went and stayed with them, and his ideas about this were somewhat through a lens of his background and not the original ideas that those people originally were committed to. So a lot of writers have expanded on Maslow's hierarchy of needs since then. And there's some great information. I referenced Dr. Cindy Blackstock. We also had a speaker, the recording of this is in our community, come and talk about this, who had spoken to elders who had direct memories of Maslow and kind of what they had tried to convey to him. But the whole point is that in that original tradition, self-actualization really wasn't like the end point. The whole idea of self-actualizing was to contribute to your community and to future generations. And I feel like when we're thinking about data, that's a really important thing to think about too. So thinking about your agency's basic needs, compliance, all that stuff, but like, how is that making it possible for you to make a difference in the communities you serve and in the future of the future world? So is there anything you would add to that, Alita?
No, I think that's fantastic. Yeah.
So yeah, I recommend doing more research on Maslow and the Blackfoot Nation. It's very interesting. And if you would like a reference to that book, we can include that information in our email that we send out from today. So the challenge with the CCBHC model from our perspective is it's really easy to get buried in that first level of the hierarchy, right? Like just to survive and to become a CCBHC, there's like a 250-page manual. There's all these FAQs. It's just such an intense process. The 250-page manual is just about the metrics. There's other manuals about other things. And this is kind of a funny picture because this is my printed copy of the manual from back in 2016, which we thought was funny because I literally still have it, which is the metrics have changed, but we're still talking about some of the same things. So that technical complexity, the metrics are really specific. It's like a whole different way of thinking about how you track outcomes. And they're very generic. They're not necessarily like what would work at your agency. They're meant to be applicable across the country. But the problem with that is we kind of, when I go back to what I hoped the CCBHC model would do, which was get us to all use similar things so we could compare ourselves. The problem is the metrics didn't really exist that would have really captured things like, are people's dogs sick and getting the medicine they need? Instead, the metrics we were stuck with were kind of from the healthcare industry. And they were a lot of things related to healthcare, which is not necessarily bad, but I think those metrics still don't quite capture the special sauce that is community mental health. And it's overwhelming for people, even just to take care of these. So it's really common to get stuck there. So we've worked really hard on developing processes and having a team of people who can really guide you through that metric process. So getting you initial access to data that can show you where you're at the beginning, and then helping you review those processes and, are certain workflows not working to get those metrics taken care of, and then kind of providing ongoing support to you and your team as you continue to improve on those metrics. So one of the things we're excited about with Janet for CCBHCs is we're just going to fold all this in to what you get with that process. So if you're already working with us and getting CCBHC stuff from us, you're kind of already getting a sneak peek of what that's like. But for brand new agencies who are like, hey, we're just starting with this, the more we've worked with agencies, the more we realize that getting started with an agency at the beginning would really be better for everybody, because if someone's involved on the ground as you build your workflows, who also understands the data you're going to need to get out, you're just going to have a much better outcome overall. We've also got a bunch of cool things that help you in that process. So ways that we can help expand what's possible from your electronic health records so that you can get a really a really robust set of things set up so that you really don't have to, so that you can spend as little energy as possible on the nonsense and as much time as possible on things that actually matter. So, setting things up so you have really nice alerts for your staff that are really custom. So they're not just like broadly like, hey, something's missing, we don't know who and for who, but it's more like, hey, this specific client who you have an appointment with today just needs to have their screening done, or hey, this specific person that, is going to be seen had a crisis last week and they could probably use some follow-up. So just really in the moment, like information that's helpful, helping you hook up like appointment reminder so that when clients are coming in, they get a reminder about their appointment, setting you up with some core reports that help you just see overall how you're doing functioning wise, and some help with form development, some help with the setup of your EHR, just some nice things we've developed over time to help make that kind of grindy process more user-friendly and easy to walk through. We have some really cool things like a self-assessment tool that you can use. It's like a guided self-assessment where instead of taking like the 300-page manual, we've got like a 3-page thing that we can go through together and talk about what you really need to know out of there. So the other thing that happens because these metrics are so hard to track is that people end up pulling the metrics like on a basis that is not all the time, right? Like they're like, I'll pull the metrics once a month, or I'll pull the metrics in the end of the quarter. And we really love to get people set up with ongoing data that's refreshing all the time so that you can be making real-time changes to improve your performance on those metrics. We like to get you out of manually entering data into reporting processes. And we want you to have real-time access. So we have at this point built out a set of reports. Some agencies are still on their own custom versions of these, but I'm going to show you some examples of the kind of metric reports we like to provide that are more real-time and give you access to information that you need in the moment. So the iServe metric, if you're not familiar yet with the CCBHC metrics and iServe doesn't mean anything to you, you are fine, and I will explain what it means. And if you are familiar with it, you probably know this is the one that is always really hard for agencies to track. And the whole idea behind it is that the intention, in my opinion, behind it is to keep track of, are people who are coming in and requesting services from your agency getting access to those services in a timely manner. And the metric defines timely as 10 business days. That doesn't have to mean you as an agency agree that that's the right way to measure it. That's just what the measurement is. And so what you do is you look at, how many days on average it takes to get from an initial contact with a person to their initial evaluation, which is great data to look at. I actually think this is one metric where I kind of agree that it's worth taking a look at, like how long does it take to get someone in? Sometimes the hardest part of this metric is defining what first contact is and defining what an initial evaluation is. And so the thing we are really great at helping people with is helping them get past that, that barrier. Like we can help you, just help you figure out what that should be, give you everywhere we've found any information about how SAMHSA defines it, and then help you get past that hurdle so you can actually start looking at the data and improving it. All of our reports that we build have easy access to both like looking at the performance over time and also looking at the things you need to report to SAMHSA at the end of your reporting period in those little charts down below. You can look at that by the different categories that SAMHSA makes you use. But the cool thing about all of our reports is you can drill through on any section and see who are those clients who are getting missed. So, you know, each of these little colorful sections you can drill through. I'm not going to do that live because this report is a little hard to, we don't have a great set of sample data for it, but this is the idea behind this report, is that you can see everything all in one place and it's set up in a way to do something about it. You can see on the left-hand side, this report includes lots of other things. So in the metrics, if someone never gets an initial evaluation, you don't have to include them in your metric, but we know you want to know who those clients are, right? If someone came in requesting services and they never got an evaluation, we know you wouldn't want those people to just fall between the cracks. So in our reports, you also get to see who was excluded because they never got an evaluation, who was excluded because the next part of the metric is, did they ever get a clinical service past their evaluation? You want to know that too. You know, how many people come in, get an evaluation, then never come back. You want to know that. So our reports always include like who isn't being counted and why, so that you can also look to see like what's going on there. So yeah. Part 3 of the metric is the other one that really gets people, which is about crisis services. So it's supposed to be the time between when someone contacted you for crisis and the time when you responded to that contact, but it doesn't count phone contacts. So that metric is just hard to like do the calculations on. So we've got that all figured out. And also that same idea, if someone never got a contact, then there's a way to go out and look at that. Is there anything you would add about our metric reports that you think is cool, Alita?
I do. You definitely touched on it, the exclusions. So you're able to see who is missing something, and that you can look at this, of course, for like reporting needs, but also you can find out what's going on with certain clients and who might need that follow-up, so you can be proactive about it. And yeah, the crisis one is definitely something that is a little bit harder to figure out workflow wise, but I think that once the data starts coming in, it will be incredibly useful for you to be able to see, who needs a follow-up, how long it's taking some services for response and everything. I think that one's really important.
And we have built some cool things on top of those metrics that we're going to show you in our impact reports, because Alita's kind of touching on this, kind of gets you partway there, but we want to look at a little bit more about these things. Since you're tracking this data anyway, what can we do to kind of show you more value out of that? So this is just another example of a metric report. This one is a little different than the iServe, because one of the things about being a CCBHC is that you are supposed to do a screening for social drivers of health for all of your clients based on certain criteria. And this report kind of illustrates that over time, as you've been a CCBHC for longer, more and more clients are eligible for that metric. So one of the things that can be kind of disheartening for folks is your percentage might be going down, even though you are still trying to do lots of these screenings, but it's because the population of people who are eligible for the screening is going up. So this gives you a nice way to see, like, again, you can drill through and see like who is in there and do we have something that's breaking in the workflow so people aren't getting this done. Alita and I have big feelings about whether people then do anything with the information in the social drivers of health screening. We encourage you to do something with that information, because the whole point of doing the screening is to get that information and then use it. So yeah. So the third thing that can happen with all of this data, so we just showed you some examples, and even with me just trying to explain it quickly so you could understand what a report was, those of you who are already familiar with the metrics are probably like, yeah. But the people who aren't are like, oh my gosh, that was even a lot right there to explain. And the thing is, because that all takes so long, especially if you don't have someone helping you, we've worked really hard to streamline that. But the thing is that you can spend so much time on those things and talking about things that are like these tiny little bits of what you do compared to like the bulk of what you do as a community mental health agency, that it's easy for that to start driving like the whole process, right? Like if you're having multiple meetings a week about how many people have had an SDOH screening, but you're never actually talking about anything else, it really can contribute to what I would call like mission drift, right? So again, we're always on the side of like your mission should be like driving everything else you do, right? Like things should be supporting that mission and lifting it up and making sure that you have what you need to serve your community. And sometimes that is one of the sad things that happens with CCBHCs, and we don't want that to keep happening. So that is why we have created what we are calling our CCBHC impact reports. There is already a thing called a CCBHC impact report that the National Council does, where they send a survey out to CCBHCs and ask them about how things have changed since they became a CCBHC. And we based a lot of our ideas off of their ideas. But this is really our theory on how you could start using this data and other data you already collect to really understand what the effect has been of becoming a CCBHC. So to build these reports, our team has spent a lot of time, and as you've heard from both me and Alita, we have other people on our team too. We're all from community mental health backgrounds, and we've talked to all of you a lot about a lot of these things, really trying to think about like, what are the things that would change at an agency if things were going better? You know, what are some of the things we would know? And so we really thought about engagement and relationships, because, you know, the thing we know about mental health and basically all things related to humans is that it usually comes back to the relationship, right? Like the main research on all this research we've done on what works best for treatment usually comes back to relationship, right? Like that's the one thing we have data on. So we thought about like, how could we start using the data we're already collecting to learn more about relationships? So as part of that, we are going to introduce some new ways of thinking about a few different things. So hopefully we're halfway in and everybody is still right here with me, because these are kind of some new ways of thinking. They're not like revolutionary, but we think that by defining them, we can come to some shared understanding about what you might want to start thinking about in your data. So the first thing is thinking about your CCBHC journey in stages. So one of the things that's hard is whenever you look at a graph about what's going on at your agency, someone has to stop and think like, oh yeah, when did we become a CCBHC? And the problem with that is it's often not one day that you became a CCBHC, right? Like you probably were going along doing your normal thing, and then like you decided, hey, we're going to become a CCBHC July 1. So you probably started making changes like 3 months before that, at least. And then once you became a CCBHC, we all know that you didn't like overnight everything drastically changed. You probably had like a ramp up period. So one of the things we've done in all of our impact reports is divide those sections out so that you could tell us when did you become a CCBHC? Okay, so the 3 months before that, we're going to say was you're setting up your CCBHC. And the 3 months after that, we're going to say you were an early CCBHC. And then that way, instead of like looking at your data and saying like, well, on June 30th, it looked like this, and July 1, it didn't look any different. So we didn't make any change. This way you can actually look at your data across segments and understand what might have changed in a more meaningful way. So CCBHC stages, first thing. The next thing is something you've already probably thought about, but everybody thinks about serving more brand new clients, right? So let's make it easy in your data to see when you had a client come in who was a brand new client. Like this is someone who you had never seen before at all, right? Like brand new. And then let's look at people who are returning clients. And this is where the CCBHC metrics do us a favor, because they actually define a returning client as someone who had a 180-day gap in services. So it's been 180 days or more since their last service, they're returning. They weren't an ongoing client during that period. And then there are ongoing clients. So thinking about breaking clients out into those categories, again, gives us some power in the other data we're going to look at. All right, third new thing. We thought a lot about this because, yes, many of the metrics, like some of those metrics that are time-based are like, okay, if you had a first contact and an initial evaluation and another service, they could have all three happened on the same day. And that would meet some of the criteria for some of those HEDIS measures that are part of the CCBHC metrics. But what you miss out on there is looking to see like how much stickiness is there with your relationship with the client that you're serving. You know, have they come back multiple times to see you? Have you gone out multiple times and they opened the door when you knocked? And so we started thinking about, instead of just counting services, what if we counted service days? So unique days when a person had a contact with your agency. And so a lot of our metrics from here forward, when we're talking about some of the other things we built, we based it on service days. So even if you saw a person today and you gave them 4 different services, which is awesome, and we already have other ways of tracking that, we want to know, like, did they come back again another time, or did you go out and see them, or what is going on in terms of more service days? And then the other thing we thought about was gaps in service days. So like if someone had a service and then a whole bunch of time went by before their next service, at what point would we kind of consider them to be starting a new engagement with your agency? Even if they're not officially a brand new client or a returning client, how would we think about that? So what would you add to that, Alita?
Yeah, the service days I think is great too. You said pretty much everything I was thinking with you could have 3 services in one day. And then that client just doesn't come back. And for the metrics, it serves a purpose, but it's not really telling you anything about how often a client is coming back. And I think looking at that and seeing, are they coming back repeatedly, and not just looking at 3 or 4 services. We're looking at the time that is passing, and what that kind of looks like, I think is important.
Yeah, we try to sit down and think about, like, what would an engaged person, if we were thinking in our clinical world, like what did it mean, and what did it mean for someone to be really engaged? And we really thought about, like, it really means you saw them more than one day, because someone can be having one day and things go great, and then they wake up the next morning and they've we all seen that before, right? Like there's often a pattern of people getting an evaluation and never coming back, and that there's a lot of theories behind that. Some of it is that maybe people have poured out their heart to you and they kind of feel a little bit better for a minute, or maybe they feel kind of gross now because they told you too much. Those of us who've done clinical assessments, we're always walking that fine line, right? Like we want people to feel comfortable sharing, but also we don't want to open up a whole bunch of wounds that we can't help them feel better about right away. So there's always that balance, and I think looking at, did they come back another day, is really helpful.
Yeah, and I think a lot can happen in just a couple of days with some clients. And so making sure that there's more than one engagement that occurs on one day. You're catching them a couple days later when their circumstances have changed.
Yeah. And I should add, guys, when we're talking about these new metrics, we're not suggesting you have to do anything more. These are reports we built that could be based on what you already record in your EHR without any extra work. And yeah, that's why we really designed these to be like very easy to implement. No additional work. We don't want you to do extra work. So then once we have these days of service or service days, we decided to think about, like, okay, like how could we distinguish where people are at their stage of engagement with your agency? And so we came up with these based on some research we did. There's a lot of research out there about the magic number 3, that like if you have an initial assessment and 2 additional engagements, especially on the SUD side of things, that's usually a sign that people have kind of gotten engaged. So for us, initial engagement would be 1 to 3 service days. 4 to 10 service days would be early engagement. 11 to 30 service days would be middle engagement, and 31 plus service days would be full engagement. So just again, to go back to our definition of a service day, that doesn't mean 31 days have gone by like in a month. It means literally 31 different times that individual and your staff have like connected somehow, either by, them coming into the office, you going out to see them, like maybe a telehealth appointment, but like they're engaged at that point. So, and really they're engaged maybe after 3 of those times. But I think looking at this helps you see like where you might be losing people. Stages of therapeutic relationship is a similar concept, but I just remembered. Well, I'll talk about it here, but with stages of therapeutic relationship, instead of being just any service at your agency, we wanted to look at like how often are people continuing a relationship with the same provider at your agency. So this was partly because we know a lot of the funding for CCBHCs, agencies have really invested in their workforce and trying really hard to reduce the turnover of staff. And so that should mean that over time, clients are having more sticky relationships with the same provider. So same idea here, where we look at the number of unique service days that have happened with the same provider over time. And so we would say 1 to 3 is initiation, 4 to 10 is early therapeutic relationship, 11 to 30 is middle, and 31 plus is full. And the thing I forgot to mention on the previous slide, but that we did with both of these, is if there's a big old gap, then we start over. So what we define as a big old gap in overall engagement would actually be like 120 days, not a full enough gap that they're a brand new returning client, but 120 days. Like if it's been more than 120 days, you're starting a new engagement. With a therapeutic relationship, we decided to go with 45 days. So that means that you might have some nuance if you were looking at this data for like people who are meds only, but we're really intending this to be about more therapeutic relationships like case management, peer support, therapists. And we would say that if it's gone more than 45 days, you're kind of reinitiating your relationship at that point. So what these categories allow us to do, oh, I think Scott had a question about, is this over a certain time period? We decided, other than what I just said about gaps, we didn't otherwise regulate where the time periods are. So like if you've had a big long gap, it starts the clock over again on the 1 to 3. I hope that answers your question, Scott. Thank you for that question. But what that allows us to do, all these defined things, allow us to have impact reports where you can look at services delivered over time based on what stage of a therapeutic relationship people were in or what stage of engagement they were in. And we have some sample data we're going to show. I'm going to show you guys a live demo of this. But what's really cool is if things are going well at your CCBHC, over time, the colors will get darker and darker because, now, of course, you're going to have clients who complete treatment and they were so engaged that they did so well that they didn't continue engaging. They graduated, they finished treatment. Those people wouldn't show up anymore as getting services. So really the people who are continuing to get services would theoretically continue to be more and more engaged and then, like I said, less of those service gaps that would make them kind of start over again, right? So we can look at all of our data then across these different kind of axes, and it's really exciting because I'll show you when we're looking at it live. So that definition stuff really helps you understand. We're going to dive into these reports themselves. The other type of report we're really excited about are reports related to crisis services, because we know a lot of CCBHCs really expand access to mobile crisis. And that's a big thing in terms of what the National Council is looking at. So we have some really great crisis reports that'll let you look at crisis services in like a heat map format. And I'm going to show this to you live too. But what's really cool is you can then look at how it's changed since you were an early CCBHC to where you're a full CCBHC. And we'll show you how that looks in the data, but it's really cool. And then the other thing we're looking about when it comes to crisis is how many service days. Again, service days are cool because you can look and see how often are people who had a crisis coming in then for another service day, and how many of the people who were in crisis, what stage of engagement were they at? What stage of therapeutic relation were they at? So that like both looking at who is having a crisis and looking at how much follow-up are people getting after a crisis. Because of course, what we all hope is people have fewer crises. So the whole hope, of course, with like mobile crisis is that we help the person in the moment, but also that then they're engaging in services and hopefully doing better. So we really love this idea. And again, these are all metrics we can track based on data that you're already tracking. You already put your services into your EHR. The other piece I just wanted to mention are our whole person outcomes reports. If you've never come to any of our topics before, whole person outcomes is a system where we can send a survey out to your clients by text message, and it collects the WHO-5 Wellbeing Index. And I know a lot of folks answered questions here about people's overall quality of life improving. The WHO-5 Wellbeing Index really measures that over time. So I'm excited to have that be part of what we offer as part of Janet for CCBHCs. So now I want to show you guys these reports in real time. Okay, so this is our impact reports. If you've never seen Power BI, it's really cool because it's so interactive. So as you can see here on our impact reports now, we have stages of CCBHC. This is all sample data, by the way. But what's really cool about this is you can select different things and see how things have changed over time, but also see how it's changed based on what stage of CCBHC you were at. So if I just click on the before CCBHC times, if I click on this little thing, you can actually see this little chart up here that shows kind of where just the overall pattern of services was in this sample data when people were pre-CCBHC. And if you wanted to just look at like once people were ongoing CCBHC, same idea. This is showing how services are now going up and up and up. And what's cool about this is if you didn't have these like kind of this is when people were starting to be a CCBH or setting up CCBHCs. It was starting to ramp up, but sometimes in early CCBHCs, it kind of levels out for a minute, and then you get to your ongoing CCBHC. So it's really cool to be able to see the data that way. We also have it set up so you can select it up here as an option and just look at one category at a time, or more than one category at a time if you want to. So that's all pretty cool. But then all of these other things are set up so you can use them. So right now we're looking at this as services based on stage of engagement, but instead you can look at it by stage of therapeutic relationship. You can look at it by our clients ongoing or brand new, or if you just wanted to look at brand new clients, you can just select brand new clients and then look at those brand new clients based on what, where they're getting services, what their age group is, all kinds of other things about them. One other category we've built in is uninsured versus insured, because for a lot of agencies, that's something they were trying to do, is hear more, serve more uninsured folks. So that's pretty cool. And then we've also added some cool categories like people who have ever been diagnosed with a substance use disorder, or people who have ever been diagnosed with an opioid use disorder. And so really just thinking about how services you provide have changed in terms of who you serve, in terms of the types of services you provide, and in terms of these new types of data we're talking about, like stages of engagement and stages of therapeutic relationship. So if you were looking, for example, if you wanted to get fancy, you could look at just the folks who had ever been diagnosed with an SUD disorder. And then you could look at that group by stages of engagement, or you could just look and see like how many of those folks that we're seeing who have ever been diagnosed with an SUD are in their initial engagement. How many of them are in full engagement? Which again, I think this sample data is pretty cool, because if, for example, this was a CCBHC who had started implementing more SUD services as part of their CCBHC program, this would be a really good sign. They're both seeing more clients who have an SUD diagnosis, but those clients are sticking, right? They're like getting engaged and staying engaged, which is really cool. Same idea with stages of the therapeutic relationship. So this is kind of cool to do together, because you can say these are people who are fully engaged, meaning they've had 30 or more services in a row at your agency without a gap of 120 days. But this is where they're at with their engagement with their therapist or with the provider doing each service. So these are, so you'd want to see this grow too, right? Like it kind of measures two different things that you can put together and see really powerful information. So that is just looking at services. We built the same things out where if you wanted to look at that by unique clients served instead of by number of services, you can also do that. Or if you wanted, this is another one that came up based on the National Council's impact reports, is unique types of providers, or like nurses. We just want to look at services from nurses, and we hired more nurses? Are we doing more services by nurses? We hired more care coordinators. Are care coordinators doing more? And are they mostly seeing brand new clients? Are they mostly seeing clients who are fully engaged? Those types of things. What I think is really exciting about these reports is how they connect to each other, connecting the different parts so that you can say, how many of the clients with an SUD diagnosis are getting services from peers? And you can do all of that in this one report. What would you say about this, Alita?
Yeah, I really like to be able to see this stages of therapeutic relationship. And I think as you start to play around with your different options for filters, you might be able to discover some things and some insights into where are people dropping off, or how are people with a specific diagnosis doing compared to others? Are there places that we can take early intervention if we start to notice a trend? I really just think it's just a wealth of knowledge that you would not be able to see otherwise.
Yeah, I was thinking about this same report being really helpful because you could easily have provider listed here. So you could just see a provider over time, the services they're doing, and are they mostly seeing new clients? Are the clients they're seeing getting engaged? Like it would be really powerful to look at by provider. We actually talked about this being one of the things that would make sense to have on a caseload report, because if you were looking at a provider's caseload, it'd be really cool to see, like back when I was a case manager, I had like a cheat sheet, right, of all my clients, and like, I haven't even met this person. I have met them. I'm still trying to engage them. This is the person I see every week, and like you'd be able to see that in this data now because of these metrics. So those are all, that's all these impact reports are, based on, again, data you're already tracking. The way of implementing this would be that we would just sit down with you and ask you a few basic questions, things like, when did you become a CCBHC? Are there any services you want to include or exclude as far as like services that count as a service day? But we want to make it really simple for you to just see your data in these reports. So we basically think we have this down to like a quick 30-minute conversation with you, and we could load your data into these reports and you could have these kind of insights right away. I think once you see them once, you're going to want more things, which we love, but we want to start you with this. And so part of our whole plan for people who become CCBHCs is that they have this information at their fingertips. The next 2 pages I just want to quickly touch on because I know we're getting close on time. Crisis services. I mentioned that we think we should do some special stuff with crisis because we know that is an area of focus of CCBHCs. And I wanted to show you how this heat map works when you click between the different stages. So in this sample data, if you were in the before times, this is how their heat map looked. And again, this is a heat map, meaning these are hours of day and day of week. So it looks like right now it kind of shrunk because there's a little fewer services in the before times in this data set. But as you go up and see that, and then a little bit of a drop off actually in when they were setting up a CCBHC in this sample data, then early CCBHC, which is really cool. You can see these little charts starting to go upward, and then ongoing CCBHC, and you can really see this expansion that's happened. And also the expansion in, because one of the things about mobile crisis is it happening just during business hours or is it happening outside of business hours? And so I really like this. I think that because this is just some sample data, there is like kind of an anomaly where there's a lot of stuff at midnight, which is probably just an error in the data. But Alita, what were you going to say? I think you really love this one too.
Yeah, I'm definitely a fan of this one because it has a dual purpose in my mind. I think that you could look at it on a higher level too from operations and staffing and say, hey, it seems that a lot of our crisis services are occurring at this time of day, maybe this time of week, and maybe we should consider where we're staffing people for this. So you're kind of prepared for those days. And you're also able to see, are these things happening outside of the community? Are people coming into our office? And then in general, there could be some trends that you might be able to notice about where these things are happening and when. And I do think it's fantastic to see agencies who weren't previously providing crisis services or only a few, they're able to see the growth, how they're really helping their community. And you're able to see, where are these people coming from? Were they clients of ours before? So this crisis heat map even plays into the other ones that we showed.
Yeah. I forgot to mention that you can actually, in this data set, you can kind of look at like community-based versus office-based, which is really interesting too. Also, what I love about even in this sample data in the office-based, like everybody comes in at 4 o'clock in crisis, which I love because we all know that is like totally true. If you've ever worked in community mental health, it's the 4 o'clock crisis. But yeah, this next page about crisis does a similar, like Alita was saying, it combines all these things into this magic. But it also adds in the feature of how many service days did people have after crisis. And what I really love in this sample data is you can really see how that has changed. In this example, if you thought of this as a CCBHC, where it used to be that people who had a crisis, had some minimal days of service after, and they were not doing a lot of crisis. But as they've been doing more crisis services, they're also getting people who get more services after their crisis. So it's like it's a tool, it's being used to engage people, which is really cool. And you can also see where people were at when they engaged in crisis. So if we look at the same set of data based on stage of engagement, oh, whoops, maybe I was already on stage of engagement. Let's see, I was already on, or it didn't change very much. But stage of engagement, how many of the people who are coming in for crisis are brand new clients? That's another thing you can look at here, which is pretty cool. So in this sample data, again, it's mostly ongoing clients, but if we wanted, we could just see by just clicking on brand new clients and then looking at, I don't know, age group. Here are the age groups of people in crisis who were brand new, whose very first service was a crisis. And then if you saw an age group that you were like, oh gosh, 11 to 15-year-olds, can we just look at that group? You could come in here and you could say, just look at 11 to 15-year-olds, but then now I want to see, like, did they get services after that day of crisis? Oh, I love this data so much, guys. It's so cool. And it's data you're already tracking. And how cool is that to be able to instantly see, and then this all would have a drill through. So you could go through and see who are the clients who were between 11 and 15, who their very first service was a crisis, and now we haven't seen what's going on with them. We haven't reconnected. I just think this is such a powerful tool. So that's the demo portion of our webinar. I want to tell you a little bit more about how you can learn more. So give me a sec to reconfigure my screen. Oh, look, that just worked. That's exciting. So if you're as excited about this stuff as we are, we want to share this. The whole idea of doing this is to, if this excites you and you want to talk about how we can help you, we want to help you, because this is where we want to help move the field, right? Like, I think if you've ever come to one of our webinars before, I always say our whole plan here is to change the world. So this is, you're in on it now, everybody. If you want to, you can always check out the page on our website that's about Janet. We have one now called CCBHC Data that is pretty cool that Crystal just put in the chat. I also wanted to remind you there are more resources in our online community about this. We'll be posting about these reports too in there. If you haven't already joined, please check that out. Oh, Crystal's put a whole link just to book a meeting to talk about this with me right there in the chat, guys. So if you're interested, please do that. But a reminder that there's a special CCBHC place in our community. And also we have an email listserv. Crystal will probably be putting that in the chat. So while Crystal's furiously putting things in the chat, I have some questions for y'all. So stand by. I'm gonna send y'all some more questions. Okay. So I would love to know which of these things were exciting to you. And I did my best to summarize some of the things I knew we would be talking about, but if I missed something, oh yes, are we going to post the slides? Yes, we will send out an email with slides to everyone who's here. We always do that. Yes. Yes, what parts? So I'm very curious of the people. Oh, yes. Thanks, Laura. No problem. So I would love to know what parts of this were exciting to you. We talked about some stuff related to workflows and trying to make things more simple. We talked about these metric reports and what we think are kind of cool in there. And then we talked about our impact reports. And it's okay, just let us know which of these things like really sparked your inspired you or made you think about things, because we're always, part of how we've gotten to where we're at is really through all of you. We work with so many agencies and we work with so many smart, committed people out there. And when we talk to you, we always get new ideas about how to use this stuff. So if this got you thinking, then we love it. We love if you're thinking about it and have some ideas. So yeah, thanks everybody for filling out the poll. It's super helpful. I know it's a lot of information. While you guys are kind of digesting that and filling that out, I just wanted to share that this last week, Alita has been here helping us get all of this stuff ready. And I know if you've come again to any of my webinars before, I always talk about this thing called deep work, which is where you just set aside distractions and sit down and work on something for a while, and how powerful that can be. And I just wanted to put a plug in for that, because when Alita and I, we've had many, many meetings over the course of probably the last year talking about this, but Alita and I talked about it and we're like, what needs to happen? The two of us literally need to be in the same room with no one bothering us for a set of hours, and we will get so much done. And that's literally what we did. So if you're feeling stuck and you have an internal team that's struggling, may I please put in a plug for giving them a one-day retreat, give them, a day where they don't have any emails. Alita and I cheated and did it on a weekend, which not everybody can do. But I just want to say that that is pretty powerful. And having just done it, I really would emphasize that. What would you add to that, Alita? Other than that, it's terrible that you had to work on a weekend.
Hey, when I love what I do, it doesn't feel like work. So I'm happy to do it. I would say there's power in numbers, and having an accountability buddy is great. And yeah, sometimes just having that ability to block your calendar for one day, sit there with a coworker and really think things through. If you're going through the CCBHC process, it's a lot, it's overwhelming. Give yourself some grace and grab somebody else and get some things taken care of together. So you're not doing it alone, because you're not alone.
Yeah. I think it's really important to think about thought partners, right? Alita and I working together, we're able to develop ideas that we wouldn't have come up by ourselves. And sometimes it's just nice to, especially when you're looking at new data like this, it's really nice to have, we had other members of our team also look at these reports and give us feedback and input. So I'm a big fan of working together as a team. So So yeah, thanks everybody for filling out the poll. I'll give people a couple more minutes. I'll just tell you a little bit about what people's overall kind of the trends are. Definitely custom alerts are something people are interested in, whole person outcomes, workflows. Everyone was pretty excited about all that stuff. iServe was cool. People were excited about being able to see people who are falling between the cracks, looking at metrics in real time, having easy way to see what services are included or excluded. I didn't even really talk about that, but we also have kind of like cheat sheets on all of our metrics, so you can see like what's included and not. Impact data or new types of data. People are excited about that pre and post CCBHC stage thing, looking at service days, looking at therapeutic relationship and engagement stages, looking at different diagnostic populations. Yeah, great. Yes, okay. I know we're getting close on time, and Crystal's reminding me I'm going to end the poll. There is a link in the chat to register for our next webinar, which is Dr. Elena Schlatka. Again, we did a webinar with her. Her whole thing is about measurement and evaluation on a shoestring. She's really, a lot of her ideas sort of sparked some of these thoughts we had too. But if you're thinking about what impact you want to have and how you could measure it, and some of the ideas today sparked your curiosity, that's a great follow-up. She's actually the author of a book. And so in our session on the 9th, we're actually going to be we sent out copies of the book to everybody who came to the webinar. That's I don't think we told you. Everyone won this. Everybody who came to the first webinar won the drawing and got a book. So I think that's right, ladies? Is that right, Crystal and Katie? Yeah. So if you were at our first webinar and you have her book, you maybe had a chance to look at it. She's coming back to talk about it again. If you haven't read her book yet, shoot me an email if you really want to come, and I'll make sure you have a link to that. Oh, we'll put that in the chat or in our follow-up email too. Hey, if you're going to be at the National Council Conference, we're going to be there. Like a lot of us are going to be there. We're taking it by storm. So join us for dinner and drinks on Sunday night. Crystal is going to put the form to RSVP. It'll also be in the follow-up email. We rented a space, or we reserved a space for a big group. We're going to have lots of good food, lots of people hanging out, and we're doing it Sunday night because usually that's not the night when everybody has the really big, we know NetSmart's going to rent out like some pavilion. We can't do that, but we're going to have a really cool party. It'll be even more fun. So come by. And then come by our booth too. We're going to be doing some cool interactive things, and we always have fun prizes. If you're interested in presenting, let us know. We always are interested. If there's something you have ideas about, please let us know. And I'm just going to skip a few slides so we can get to the question slide. Stand by. Yeah. That's my contact information. And I skipped over a few things because we're kind of short on time. Hey, everybody. I know we had a lot to share today. If you can't tell by how fast I was talking, I'm really excited about this. There'll be more to come. This won't be our first time talk. I mean, this is our first time, but this won't be the last time we talk about these things, because as you can see, we're all pretty passionate about it. It's a group effort. Everyone on our team contributed to this. Crystal, Katie, Nicole, Andrew, Libby, Kate, the other Katie. We have two Katies now. The other John, we have two Johns. Everybody contributed to this effort, and I'm so grateful to them, because this kind of feels like, again, another step forward in this mission we have to change the world. So thanks everybody for being here. We appreciate you all. And yeah, hit me up if you have questions, thoughts, ideas. We appreciate your all's brains too. So hope you all have a good rest of your day. All right. Thanks, Alita. Thanks, everybody.
Thanks.
Okay.